You gave up ice cream the day you were diagnosed, and you did it because someone you trusted told you to, because it felt like the responsible decision, because managing your blood sugar meant accepting that certain pleasures were no longer for you. I want to tell you something that the standard advice you received left out, and I want to be direct about it because the omission has cost people years of unnecessary deprivation. A clinical trial published in Frontiers in Nutrition in 2024, conducted at the Dasman Diabetes Institute on patients with type 2 diabetes, measured something that most physicians have not yet integrated into what they tell their patients. Real full-fat ice cream has a glycemic index of 37. Whole wheat bread, the food most people with diabetes are actively encouraged to eat, has a glycemic index of 74. White rice is 72. The dessert you gave up raises your blood sugar more slowly than the toast you had this morning. That is not a reassuring approximation. That is a clinical measurement from a peer-reviewed trial conducted on diabetic patients specifically. But I need to be honest with you about something equally important, because this is where the story becomes more complicated than simply returning to the freezer aisle and picking up whatever looks familiar. After giving up ice cream, most people reach for what feels safer. Frozen yogurt with its clean, health-oriented packaging, sugar-free pints with the words diabetic-friendly on the label, low-fat and light versions that seem like the medically responsible choice. And some of those substitutes are raising blood sugar more significantly than the ice cream that was given up in the first place. Today, I am going to give you 5 ice creams you can safely bring back into your home, and I'm going to warn you about 3 products that are quietly misleading the people they claim to serve under language designed to feel like medical guidance. My name is Dr. Kenji Sato. I am a preventive medicine physician and longevity researcher, and the misinformation surrounding dessert and blood sugar management in diabetic patients over 60 is one of the most consistent and most correctable sources of unnecessary dietary restriction I encounter in clinical practice. The goal of blood sugar management is not the elimination of pleasure. It is understanding which foods actually threaten glycemic stability and which ones do not, and making decisions based on that understanding rather than on marketing language or oversimplified rules. Before we continue, one clinical note. Everything I am describing today addresses nutritional strategy for blood sugar management in the context of type 2 diabetes and prediabetes. If you are on insulin, if your HbA1c is above 8, or if you have any condition that requires strict glycemic control, the framework I'm providing today must be applied in conversation with your managing physician. I will note specifically at certain points in this discussion where individual glucose monitoring is particularly important. The information here is educational and designed to complement your clinical care, not to replace it. Now, why ice cream behaves the way it does in the diabetic body? The clinical finding about ice cream's glycemic index surprises most people because they have been conditioned to think of it as pure sugar and fat, a combination that should spike blood sugar immediately and significantly. The reality is more nuanced, and understanding the mechanism is what allows you to make genuinely informed choices rather than simply trusting whoever has the most authoritative-sounding label. When you eat real full-fat ice cream, 3 separate physiological breaks engage simultaneously. The first is the fat content itself. Dietary fat slows gastric emptying, which is the rate at which food moves from your stomach into the small intestine where glucose absorption occurs. When fat is present, that transition slows significantly. Glucose enters the bloodstream gradually rather than in a rapid surge. The second is the dairy protein. Protein from dairy sources triggers the release of GLP-1, glucagon-like peptide 1, which is the hormone that pharmaceutical interventions like semaglutide attempt to replicate artificially. GLP-1 slows digestion, signals satiety, and moderates the insulin response to incoming glucose. Real dairy protein activates this pathway through the same biological mechanism the medications target, through food rather than injection. The third is temperature. Cold food requires your stomach to warm it before digestion can proceed efficiently. This thermal processing adds additional time before glucose from the food reaches your bloodstream. 3 simultaneous breaks. Fat slowing gastric emptying, protein triggering GLP-1, Cold temperature adding a processing delay. This is why real full-fat ice cream in appropriate portions produces a more gradual and moderate blood sugar response than the glycemic index of its individual sugar content would suggest. The products I'm about to discuss either preserve these mechanisms, add to them, or strip them away entirely. That distinction determines everything about their effect on your blood sugar. The first option is one I want you to consider making at home, and I recognize that asking someone to make their own ice cream requires justification. The justification is that nothing available commercially at any price point produces a more favorable blood sugar response for the effort involved. Cottage cheese ice cream. When full-fat cottage cheese is blended until completely smooth and then frozen, the texture that results is remarkably close to soft serve. What it delivers nutritionally is what separates it from every commercial option on this list. A half-cup serving provides approximately 14 grams of protein. That is roughly 3 times the protein content of a standard scoop of conventional ice cream. 14 grams of protein produces a substantial GLP-1 response, the same mechanism I described above, and nearly doubles the time food remains in the stomach before glucose absorption begins. The result is a slow, gentle, manageable glucose rise with no sharp peak and no subsequent crash. For anyone over 60, there is an additional reason this protein content matters that has nothing to do with blood sugar directly. After 60, the body begins losing lean muscle mass at a rate that accelerates with each decade. This process, called sarcopenia, affects strength, balance, and functional independence in ways that are directly relevant to quality of life and fall risk. Every gram of high-quality protein consumed daily slows this process. Cottage cheese ice cream is doing 2 things simultaneously, protecting your blood sugar and protecting your muscle mass. The recipe requires 1 cup of full-fat cottage cheese. The fat content is not optional. It is providing the gastric emptying brake that is one of the 3 mechanisms. Add 1 tablespoon of allulose or erythritol, 1 teaspoon of vanilla extract, and a handful of frozen berries if desired. Blend until completely smooth. Freeze for 2 to 3 hours, stir once, and serve. Approximately 120 calories per half cup with 5 to 7 grams of carbohydrates. The second option is homemade frozen Greek yogurt, and the word homemade carries more clinical significance here than it might appear to. What you make at home from full-fat plain Greek yogurt and what comes out of a commercial frozen yogurt machine or a supermarket carton are nutritionally and glycemically 2 entirely different products. I will explain precisely why when we reach the warning section. For now, understand that the homemade version preserves everything that makes this food favorable, while the commercial version eliminates most of it. Full-fat plain Greek yogurt frozen at home provides 8 to 10 grams of protein per serving. It preserves the natural fat content that provides the gastric emptying brake, and it retains something that most discussions of frozen desserts overlook entirely. Live probiotic cultures, lactobacillus, and the other beneficial bacteria present in real Greek yogurt have documented effects on insulin sensitivity when consumed consistently over weeks and months. The mechanism involves the gut microbiome's bidirectional communication with metabolic signaling pathways. You are not simply avoiding a blood sugar spike with each serving. You are gradually improving the underlying cellular response to insulin that determines how your body handles glucose in every meal. This is a cumulative benefit that compounds over time in a direction that serves your long-term metabolic health. The recipe requires 2 cups of full-fat plain Greek yogurt, 2 tablespoons of allulose or erythritol, 1 teaspoon of vanilla extract, and berries of your choice. Pour into a freezer-safe container and stir every 30 minutes until firm, or use an ice cream maker if you have one. I want to tell you about a patient I will call Catherine, 68 years old. She walked into my office having eliminated every dessert from her diet after her HbA1c reached 8.1. She was practicing strict deprivation, and she was unhappy in a way that was affecting her relationship with food broadly, creating anxiety around eating that was producing its own stress-related metabolic consequences. 3 months later, she came back. Her HbA1c had dropped to 6.9. She looked at me with something between embarrassment and satisfaction and told me she needed to confess something. She had been eating frozen yogurt every night after dinner. She described her protocol precisely. Half a cup homemade full-fat Greek yogurt made exactly as I have described, served in a small glass cup that had belonged to her mother because, in her words, if she ate from the container, she would eat the entire container. The portion discipline was built into the ritual. What 6 months of strict deprivation had not achieved, a daily modest pleasure taken thoughtfully and consistently produced in 3 months. The metabolic benefit of the probiotic cultures accumulating over time, the reduction in stress-related cortisol that had been working against her insulin sensitivity, the sustainability of an approach she could actually maintain. The third option is for the evenings when making something at home is not realistic and you need something you can pull directly from the freezer. Ice cream sweetened with erythritol and stevia. Both of these sweeteners have a glycemic index of 0. Erythritol passes through the body almost entirely unchanged. It does not get converted to glucose. It produces no meaningful insulin response. Stevia, derived from the stevia leaf and used as a sweetener in South America for centuries, produces the same result through a different mechanism. Neither one triggers the glucose and insulin cascade that makes conventional sweeteners problematic for blood sugar management. 3 brands that meet this standard and are available in most major supermarkets. Halo Top, particularly the Golden Blondie and Vanilla Bean varieties, provides approximately 21 grams of carbohydrates per 2/3 cup serving and is available at Walmart, Target, and Costco. Enlightened Keto line provides 1 gram of net carbohydrates per serving, which represents the strictest available option for someone wanting the tightest glycemic control. So Delicious No Sugar Added uses a coconut milk base, making it appropriate for anyone who experiences sensitivity to dairy. When reading labels for this category, look for erythritol and stevia leaf extract near the top of the ingredient list. That is the sweetener system is what it should be. One honest clinical note for this age group. After 60, the gastrointestinal system can develop increased sensitivity to sugar alcohols. In larger amounts, erythritol can cause bloating in some individuals. Begin with a 1/4 cup rather than the 1/2 cup the serving suggestion indicates. Assess your individual response before increasing the portion. The fourth option involves a sweetener that most people in this age group have not yet encountered, and the research published about it in 2024 warrants your specific attention. Ice cream sweetened with allulose. In 2024, a meta-analysis published in the journal Metabolism Open examined 6 clinical trials covering 126 patients with type 2 diabetes specifically. The finding was more significant than simply confirming that allulose is neutral on blood sugar the way erythritol is. Allulose actively lowered post-meal glucose levels. It reduced the total area under the glucose curve. It reduced the time patients spent above safe blood sugar thresholds. To put this in the clearest possible terms, erythritol is a passenger. It rides through the body without raising blood sugar and without lowering it. Allulose functions more like a 4th brake, not simply avoiding the spike, but actively pulling glucose levels down in the post-meal window. 2 brands built on this sweetener. Rebel Ice Cream uses a full-fat heavy cream base with 0 added sugar. Real-world data from individuals using continuous glucose monitors shows blood sugar rising only approximately 15 milligrams per deciliter after a serving, which is a remarkably contained response. Nick's Swedish style uses a blend of allulose, erythritol, and stevia, and produces a flavor and texture profile that is closer to conventional ice cream than most alternatives in this category. Both are available at Whole Foods, Sprouts, and Kroger, with expanding availability at Walmart and Target. The honest disclosure on this option is cost. These products run $6 to $7 per pint, which is meaningfully more than the erythritol stevia options. This is the appropriate choice for someone who wants the best available blood sugar outcome from a commercial product and is in a position to invest accordingly. The fifth option is the one I want to address last because it costs less than $2 per serving, requires no special ingredients, outperforms every commercial product discussed above on blood sugar response, and almost certainly has its primary ingredient sitting in your kitchen right now. Frozen banana processed into soft serve. I understand the immediate skepticism. A banana has a glycemic index of approximately 51 for a fresh ripe fruit, which is not an ideal number for blood sugar management. What that number does not account for is what happens to banana starch during the freeze-thaw cycle. When a banana is frozen and then thawed, a process called retrogradation occurs within the starch structure. A significant portion of the banana's regular digestible starch converts into resistant starch. Resistant starch behaves fundamentally differently from regular starch in the digestive system. It resists enzymatic breakdown. It does not get converted to glucose in the small intestine. It passes through largely intact, where it functions as prebiotic fiber for beneficial gut bacteria. Research published by Johns Hopkins and confirmed by agricultural research through Clemson University Extension demonstrates that resistant starch improves insulin sensitivity and significantly reduces the post-meal blood sugar response compared to the same carbohydrate load from non-resistant starch. The frozen banana that emerges from this process is glycemically distinct from the fresh banana that went into the freezer. The complete recipe requires one ripe banana sliced into coins and frozen for 4 hours, which is the threshold required to trigger meaningful retrogradation. 2 tablespoons of natural peanut butter with no added sugar, which provides a powerful GLP-1 trigger and adds the fat content that slows gastric emptying. Half a teaspoon of true Ceylon cinnamon, which has documented effects on GLUT transporter activity and glucose clearance from the bloodstream, and 1 tablespoon of unsweetened pure cocoa powder, which contains epicatechin, a compound with evidence for supporting pancreatic beta cell function. The cells responsible for insulin production. Blend all ingredients in a food processor until smooth. The texture is indistinguishable from soft serve. The sweetness comes entirely from the banana. There is no added sugar of any kind. The cost is under $2 per serving. There are no sugar alcohols to cause gastrointestinal sensitivity. One specific caution: individual glucose responses to this preparation vary. The first time you try it, check your glucose meter 1 to 2 hours afterward, particularly if your HbA1c is above 8.0 or if you are on insulin. Your meter provides the ground truth about your individual response that no general guidance can replicate. Now, the 3 products that require genuine caution, including one that may be in your freezer right now under language that was designed to make you trust it. The first warning is low-fat, fat-free, and light ice cream. For decades, the dietary advice given to patients with diabetes and cardiovascular concerns emphasized reducing fat intake. That advice, applied to ice cream, produced a category of products that removes the single most important of the 3 breaks I described earlier, while simultaneously increasing sugar content to compensate for the lost richness and palatability. When manufacturers remove fat from ice cream, the product loses the gastric emptying delay that fat provides. To maintain the flavor and texture that makes ice cream worth eating, they add more sugar. The result is a higher sugar load entering a digestive system that has lost the mechanism designed to slow its absorption. The blood sugar response is faster, higher, and more sustained than the full-fat version it replaced. The data from continuous glucose monitor tracking confirms this pattern. Research tracking over 600 individuals found that reduced fat and soft-serve ice cream raised blood sugar by an average of 43.9 milligrams per deciliter. Regular full-fat ice cream raised it by 35.4. That difference is clinically meaningful, and it runs precisely opposite to what the labeling implies. This was not a failure of personal judgment. It was a marketing success that misrepresented itself as a medical recommendation. Patients who made this switch did so in good faith based on guidance that was not accounting for the specific mechanism by which full-fat ice cream moderates its own glucose impact. The brands in this category to leave on the shelf include Breyer's Fat Free, Edy's and Dreyer's Slow Churned Light, Skinny Cow, sherbet, which is low in fat but high in sugar, and sorbet, which delivers pure sugar with no fat break operating at all. The practical label rule: if the packaging uses the words light, fat-free, low-fat, or skinny, the product belongs back in the freezer case. The second warning is commercial frozen yogurt. This is the food that an entire generation was directed toward as the responsible alternative to ice cream, and the numbers reveal a problem that the marketing successfully obscured. Dannon Light and Fit Frozen Yogurt, which is positioned and packaged as the medically appropriate choice, contains 21 grams of sugar per half cup. Häagen-Dazs Vanilla, the premium full-fat ice cream that patients with diabetes have been avoiding, contains 20 grams of sugar in the same half-cup portion. The frozen yogurt has more sugar than the ice cream it replaced, and because commercial frozen yogurt is also low in fat, the gastric emptying brake is not operating. More sugar is entering the bloodstream faster than if the patient had eaten the ice cream they were told to avoid. The self-serve frozen yogurt shop experience, which has been positioned as a health-conscious dessert choice, deserves specific attention. A medium serving with standard toppings including granola, sauce, and fruit can deliver 60 to 80 grams of sugar in a single portion. That is among the highest glycemic loads available in any retail food setting. I want to be unambiguous about one distinction. The homemade frozen Greek yogurt described earlier in this discussion is a completely different food from commercial frozen yogurt. The homemade version preserves the fat content, the live probiotic cultures, and the protein structure of full-fat Greek yogurt. Commercial frozen yogurt is processed in ways that eliminate most of these properties while adding sugar to maintain palatability. They share a name and almost nothing else from a metabolic standpoint. Commercial chains and brands in this category to avoid include Pinkberry, Menchie's, 16 Handles, Red Mango, Yogurtland, Yasso frozen yogurt pints, Dannon Light and Fit frozen yogurt, and Stonyfield frozen yogurt. The third warning is the most important one on this list, and I want to give it the attention it deserves because it is the product most deliberately designed to earn the trust of exactly the people it is harming. Sugar-free ice cream sweetened with maltitol. The packaging tells you everything you want to hear. Sugar-free, designed for people watching their blood sugar. The kind of language that feels like it was written by someone who understands your diagnosis and wants to help you navigate it. The ingredient list tells a different story. Maltitol has a glycemic index of between 35 and 52, depending on its form. Its insulin index is 27. These numbers are dramatically higher than every other sugar alcohol used in this category. Erythritol, for comparison, has a glycemic index of essentially 0 and an insulin index that is negligible. Maltitol raises blood sugar and triggers insulin response at levels that peer-reviewed nutrition research has described as significant, unlike erythritol, which has almost none of this effect. The compounding problem is behavioral. Because the label says sugar-free, people consume larger portions than they would of a product they knew contained sugar. The total glucose impact in real-world consumption is sometimes worse than eating conventional full-fat ice cream, because the label-driven overconsumption multiplies the already meaningful glycemic load of the maltitol itself. For patients over 60, there is an additional physiological concern. Maltitol acts as a laxative at the quantities present in a standard serving of these products. It causes bloating, gastrointestinal distress, and diarrhea in many individuals. Diarrhea produces dehydration. Dehydration concentrates the glucose already circulating in the bloodstream, amplifying the blood sugar spike that was already occurring from the maltitol itself. The cascade is self-compounding in precisely the wrong direction. I want to tell you about a patient I will call Kenneth, 71 years old. He came to my office with an HbA1c of 7.4 that he could not explain. He had been strictly avoiding sugar for 6 months. He was confident in his compliance. He had saved every food label he had read since his diagnosis, which he kept in his wallet, because that was the kind of careful and conscientious patient he was. When I reviewed what he was eating, the picture became clear. Breyer's no sugar added, 2 to 3 times per week. The third ingredient on the label he had trusted was maltitol. We made one change. He switched to Halo Top. 3 months later, his HbA1c had dropped to 6.6. What he said at that visit has stayed with me. He said that he had done everything he was told, but it felt like someone had forgotten to give him one critical piece of information. He was right. That piece of information was available. It simply was not being communicated to the people who needed it most. The brands in this category to leave on the shelf include Breyers no sugar added, Turkey Hill no sugar added, Edy's and Dreyer's no sugar added, and virtually every store brand sugar-free version at major chains. The label rule for this category requires only 5 seconds. Scan the first 3 ingredients. If you see maltitol, maltitol syrup, or sorbitol, put the product back. You do not need to read further. Now here is the practical framework for bringing this into your daily life. Tonight, open your freezer and pick up every sugar-free product on the shelf. Read the first 3 ingredients. If maltitol appears, remove it. This is the single highest impact action available to you in the next 10 minutes. Going forward, the timing of when you eat ice cream matters as much as which ice cream you choose. Always eat it after a dinner that contains at least 20 grams of protein and real fat. The protein and fat from your meal are already engaging the gastric emptying and GLP-1 mechanisms before the ice cream arrives. Never eat ice cream on an empty stomach and never between meals as a standalone snack, because without the meal context, those brakes are not operating. Portion discipline is the other non-negotiable. Scoop half a cup into a small bowl and return the container to the freezer before you sit down. Eating from the container removes the visual and physical cue that a portion has been completed. A small, dedicated bowl, preferably one that holds nothing more than the portion you intend to eat, is a behavioral tool that costs nothing and produces consistent results. Finally, gather your own data. Check your glucose meter 1 to 2 hours after trying any new product. The published glycemic index of a food is an average across populations. Your individual response depends on your current insulin sensitivity, your medications, the meal context, and your specific gut microbiome composition. Your meter tells you the truth about your body that no chart can replicate. You gave up ice cream because someone you trusted told you that you had to. That decision came from good faith and genuine concern for your health. What you were not given was the complete information that would have allowed you to make a more nuanced choice. Ice cream was never the unconditional enemy. The kind of ice cream, the composition of what you eat it after, and the portion in which you consume it, that is where the actual answer has been the entire time. You now have 5 options you can safely return to your freezer and 3 products you can identify and remove. You have the mechanism behind each decision, not just the conclusion, which means you can evaluate new products as they appear, rather than waiting for someone to give you permission. I am Dr. Kenji Sato. If this gave you information that the standard post-diagnosis guidance did not provide, share it with someone who gave up a simple pleasure the day they were diagnosed and has not yet been told that some of those pleasures were never actually the problem. The answer to better blood sugar is not maximum deprivation. It is accurate information about what is actually happening in your body and the ability to act on it. I will see you in the next one.